My name is Tanisha Young, and I am the creator and host of Children in Crisis, the foster care system. I am currently a graduate student at Texas Southern University in the counseling department, and I worked for the Texas Department of Family and Protective Services for 7.5 years. Today's information is just a brief synopsis of some of the challenges faced by children that are in the foster care system. Foster parents, new caseworkers, attorneys, and other professionals and volunteers who work with youth may find today's information helpful.
In this training today, we'll look at statistics of abuse and neglect, the impact of abuse and neglect, some treatment modalities, and a few resources that are currently available. The state agency that is responsible for investigating abuse and neglect in Texas is the Texas Department of Family and Protective Services. It is most widely known as Children's Protective Services, or CPS, and the agency has a responsibility to investigate reports of child abuse and neglect, protect children from abuse and neglect, and to find permanent homes and living arrangements for children who cannot remain in their homes. When a report is received, CPS investigators conduct an investigation to determine the legitimacy of the claim. In the CPS fiscal year of 2012, there were 97,688 children in confirmed investigations, and 16,972 children were removed from their homes. Neglectful supervision accounts for the highest percentage of cases at 69%. Neglectful supervision may include leaving children unattended or exposing them to a situation that may lead to further harm or danger. Physical abuse accounts for 16% of cases and includes excessive physical harm that may lead to bruises, burns, or other injuries. Sexual abuse constitutes 8% of the cases, followed by physical neglect in 7% of cases. Physical neglect may include cases where children's medical and physical needs have not been met. Contrary to popular belief, many children in foster care are older, with the average age being 9 years old. The typical length of a CPS case is 12 months. However, on average, children stay in foster care for 2 years, and approximately 10% of children have been in foster care for 5 years or more. About 11% of the children that left care in 2011 aged out of the system. Children who age out of foster care are highly likely to have poor outcomes. Another key statistic is a disproportionate number of African American children in foster care. African American children tend to remain in care longer, have lower rates of reunification than white children, and receive fewer comprehensive services. When children are determined to be at risk of immediate or future hurt, harm, or danger, there are several placement options available for those children. As of August 31st, 2012, there were 27,919 children in substitute care in the state of Texas. Substitute care is a placement that is outside the home where the children were removed. Child placement agencies provide the highest number of foster and adoptive homes. These are agencies that contract with the state of Texas to provide placement for children. The Texas Department of Family and Protective Services also has a department that oversees foster home and provides foster and adoptive placements for children who have been removed. The second highest placement are kinship and relative placement. These are family members or family friends that have a prior relationship with the children and are the first step for placement when children are removed from their homes. Some children are also placed in what are known as residential treatment centers. These are for children who have more severe behavior and mental health problems and may not be suitable for placement in a basic or moderate level or severe level foster home. They need more one-on-one attention, and more therapeutic services. There are also emergency shelters that are available whenever there is a foster home not immediately available when children are removed. They can be placed in emergency shelters for up to 90 days until a slot becomes open. There are also other basic childcare placements like cottages and campus type settings. And then the other variety consists of some children that may be in juvenile placements, but they are still in the custody of Children Protective Services, or they may be hospitalized for various reasons. The trauma experienced from the abuse and neglect, compounded with being removed from their home, can cause children to suffer from multiple issues. Developmental issues can especially occur when the trauma occurs when children are in their younger, vulnerable years. Because of these factors, children in foster care have shown significantly lower abilities in their language development, cognitive functioning, and sensory motor functioning. Also, key factors in development of self-esteem, trust, identity, and relationships are formed through attachment to a responsive caretaker, so addressing attachment issues is vital in helping children deal with abuse and neglect. Children can also develop a sense of weakness and loss of control due to their perceived vulnerability and inability to protect themselves. If left unresolved, they can experience feelings of shame and doubt. A lack of impulse control can also develop, including temper tantrums, lack of respect for authority, being argumentative, and some children may channel their anger and lack of control by physically hurting others or pets. Some outward manifestations of the trauma include attention problems, social problems, and delinquent and aggressive behaviors. Low academic achievement among some foster youth may be attributed to their attention and cognitive problems. They also may develop some antisocial traits such as borderline personality disorder, inappropriate displays of affection, and attachment difficulties. Studies have also shown a high correlation between child abuse and juvenile delinquency. Victims of abuse and neglect are at a higher risk for criminal activity and for becoming abusers themselves. Children in foster care may also experience psychological difficulties that impact their well-being. They exhibit higher rates of depression, low self-esteem, substance abuse, social isolation, and marital discord. Mental health problems can exacerbate former foster youth's ability to locate and maintain employment, as well as lead to homelessness. With all of the issues and problems that can arise with the trauma of being removed from their home, what can we do to help these children put the puzzle pieces of their life back together? As stated previously, some children may develop trust issues from the trauma of the abuse or neglect that they experienced in their home or the trauma of being removed from their home, which makes it difficult for them to understand and trust in the therapeutic process. However, therapy can help children of various ages address the aforementioned problems that may arise from the trauma of abuse and or neglect. In therapy for abused and neglected children, two important factors need to be addressed by the therapist. Therapists need to help the children internalize the right to safety and protection, and they also need to help them identify ways to cope with comparable situations in the future. Primary prevention programs provide education to children about their rights to safety and protection. This method may be most beneficial prior to abuse and neglect occurring, but it could also be useful to children whose permanency goal is reunification with the parent, as it may be helpful in preventing future abuse and neglect. For younger children who may not be able to express themselves verbally, Play therapy can be used to help them express their feelings, develop mastery and control over their feelings, and work through other issues surrounding their experiences. Individual therapy can cover various topics and help address multiple issues such as appropriate behaviors, interpersonal skills, and understanding and resolution of the child's experiences. Family therapy usually occurs when reunification with the parents is the goal. It can help the family work on family dynamics and cohesion and explore roles and relationships. For children who need help with developing interpersonal skills or have issues with feeling isolated, group therapy may be beneficial. Here are a few resources that are typically connected with children who are in foster care. The Children's Assessment Center provides counseling and services for victims of sexual abuse. The Children's Crisis Care Center provides evaluations and psychological evaluations for children who have been removed from their homes. Early Childhood Intervention, or ECI, works with children under the age of 3 who have disabilities and developmental delays. The Mental Health and Mental Retardation Authority handles crisis and emergency services and children and adolescent mental health services. Children who are in substitute care are on Medicaid, therefore it is important to find service providers that accept this form of payment. Here is a list of mental health hospitals who accept patients who are in a psychiatric crisis, which may include being a danger to themselves or others. Although therapy is beneficial, reform of the system and greater advocacy for the best interests of the children need to be a part of addressing the crisis. Lessening the time children are in foster care could possibly improve their overall outcome and decrease the amount of developmental, behavioral, and psychological problems. When it is unavoidable to remove children from their home, the services they receive while in foster care should adequately meet their medical, educational, and mental health needs. A greater effort should be made to ensure the services are implemented in a timely manner and addresses the appropriate issues. A greater effort should also be made to license more foster and adoptive homes that are able to meet the needs of the children and decrease placements in residential treatment centers, juvenile facilities, and hospitals. And finally, caseworkers, attorneys, and other professionals need to be adequately trained on recognizing the needs of children in foster care and how to better coordinate services.
I hope you were able to find this information useful. If you have any additional questions or any follow-up information, you may contact me at the information listed. Thank you.